The gallbladder and pain associated with gallstones, or stones as most people know them. So let's appreciate a little bit of the anatomy first. The gallbladder is nothing more than a vesicle. It sits just underneath the liver itself. The liver has 4 lobes, 8 anatomical segments, but 4 anatomical lobes. The lobes are the right lobe, the left lobe, which is separated by the falciform ligament, and underneath the inferior aspect, so on the bottommost surface, you've got the quadrate lobe and the caudate lobe. The gallbladder is housed by the quadrate lobe under the liver. It's a vesicle, like I said, and what it does essentially is it stores the bile which is produced in the liver itself. So the bile is then released in turn into the duodenum, which is part of the small intestine, via the ampulla ovata. The purpose of the bile is to emulsify fat, which essentially means it breaks down the fatty foods that we eat. So when you've had a nice greasy meal, the fats inside there need to be broken down and digested, hydrolyzed. So the bile is released into the duodenum, which then breaks down the fats so that the lipase enzymes can actually work on that to actually break it down. Okay, now what happens is there is a little duct that comes out from the actual bile that connects it to the actual tube which goes down to the small intestine, what we call the common bile duct. The gallbladder has actually got one of the walls is component is muscular, so it's a muscular component to that wall. If we have some gallstones that are found inside the gallbladder that are trying to actually pass through the cystic duct, what the gallbladder actually does is it actually contracts. And as it contracts, it's actually contracting with a view to try and push that actual gallstone through the cystic duct into the common bile duct. Now, if it's relatively large and it's difficult for it to pass through that passage, then that's where the difficulty arises. As such, we then experience pain. Where? Well, the liver, remember, sits here on the right upper quadrant. So in anatomical terms, the abdomen can be split in 4, and we call it the right upper quadrant. So that's where the liver sits, between ribs 5 to 9. Underneath that, so just at the costal margin, is where you get the gallbladder. And what happens is, as the gallbladder is squeezing, that intensifies the pain. Because, again, like I said, squeezing to try and pass that gallstone through the actual passage, the cystic duct. When it then relaxes, that's when you get the relief, but there's always a constant background pain. Hence, the pain, it weans up and down. It's always there. It's wave-like, and that's what we call any wave-like pain in the body is what we call colicky pain. You can also get pain actually radiating to the actual right shoulder in such situations. Why? Because the phrenic nerve sits very closely to that, so if the gallbladder is inflamed, it will irritate the nerve and manifest here as a referred pain.